Chris, those waiting times numbers are staggering. They're even more bewildering when you spend a day here and you see every single member of staff is working flat out and every corner of space is being utilised, and still across this entire hospital, across this entire health system, those numbers aren't decreasing, they're not even staying still, they are increasing. As of right now, every single one of the 500 beds in this hospital are full. 100 of those patients could have gone home today, but there isn't anywhere in the community for them to go to. Systemic change is needed, say health experts. But remember this, health is a devolved issue. Decisions are down to the Northern Ireland Executive, and the Northern Ireland Executive isn't sitting right now over arguments about the Northern Ireland Protocol. And while decisions aren't being made in Stormont, ambulances continue to stack up, patients continue to wait. The demand is unrelenting.
Sometimes we have patients here for 5 days.
And the system is buckling.
It's really tough. So you're talking about a service that I don't think it's unfair to say is collapsing around them.
Caution, patient lift in operation.
Tuesday morning at Craigavon Area Hospital, where there are no slow days. This elderly patient fell and spent the night on the floor. Fortunately, her wait outside in the ambulance, waiting to be seen by Dr. Gareth, was only 45 minutes today. Delays here are the new normal, with new, expensive additional costs.
This looks pretty new. We've refurbished it, trying to get more toilets in the emergency department, trying to get an area with a shower. Yeah. So if you imagine, we've had people here for 100 hours. You know, we've had people here for 4 or 5 days. So,
wait a minute. So someone comes into A&E and they've been here for 4 or 5 days?
Yes, we've experienced that, unfortunately.
Why?
Because there are absolutely no beds anywhere else in the hospital that they can go to.
Okay.
And so we refurbished this because we had to have cubicles with proper doors on.
So you almost had to change the infrastructure of the A&E to accommodate people who just wait for so long now?
Absolutely.
Every inch of this accident and emergency department is now treatment space, even corridors. How long have you been here for?
Since last night.
Okay. Long night?
Very. Very noisy.
Is there ever a day where you actually have enough resources for the people that you're coming through the door?
Not this last year. It has been constant. It has been always behind. We're always been struggling. We've never had enough to meet the demand. I can't even think of one day this year, not in the summer, not in the holiday time, no. Okay, I'm gonna get a scan of your brain done and we'll come back and see you, okay? Yes.
This patient came in this morning with a suspected stroke. Fortunately, the ambulance was prompt, and getting him off the ambulance into A&E was also prompt. But right now, in Northern Ireland, that is not always the case. Because of the stresses that the ambulance service is under at the moment in Northern Ireland, are patients coming to harm?
Yes, patients are coming to harm. And again, I don't think that's a controversial thing to say. Patients are coming to harm on a regular basis. And that is...
To what extent?
So it's multifactorial. So people are dying probably that shouldn't die. People, for things like strokes and heart attacks, if we're not getting to them quick enough, are they getting treatment quick enough? You know, that's the type of issues that we're facing up to as a health service and a society, that we can't get to people in time, and people are asking us for help and we want to be helping them and we can't.
The Northern Ireland Ambulance Service is currently examining 8 incidents of delayed response where deaths are involved. But delays aren't just at the sharp end, they run throughout the entire healthcare system.
At the minute, I was meant to be seen in December, and that was on a 12-week waiting list, and haven't heard any news yet for my asthma.
Okay, so have you got any idea when you're going to be seen?
Not yet. At the minute, it's probably going to be about March time, end of February, start of March is going to be the earliest.
That's longer than 12 weeks then?
Yeah, a lot.
Despite the smiles, Anushka is nervous. Her last severe asthma attack was near fatal. She's torn because she doesn't want to hassle hospitals already under pressure, but getting to see specialists here has been known to take inconceivable amounts of time. So when did you first know that something was wrong and you got in touch with the doctors?
That was about March 2017.
And when did you actually get to see someone in any form?
That's in terms of neurology.
Yeah.
I've never seen a neurologist. Phone call was only contact I've had with the doctor.
And when was that?
March last year.
So 5 years you
5
had to
years.
wait? Just for a phone call?
Just for a phone call. I've never ever seen a neurologist.
Eileen's condition was diagnosed on that phone call, but the stress induced over years waiting for it, she says, was intolerable, contributing to her eczema. Yeah. She took South Eastern Health and Social Care Trust to court, though a judge ruled it's not for courts to legislate the length of waiting lists. Eileen's appealing the decision, and the Trust say they are continuing to work hard to reduce the time any patient must wait. While healthcare across the whole of the UK is struggling, experts say there are problems unique to this corner of the Union.
In the last decade, we've had 7 major reports pointing out what we need are fewer hospitals, more specialism and a much bigger emphasis on prevention. All of our politicians say that they agree with these plans, but when it comes to actually enacting them, which might mean closing local services, closing smaller hospitals, then suddenly there is a problem and they don't want to do it.
There is one other major factor here, governance, or the lack of it. Since the regional elections last year, the DUP have refused to re-enter power sharing at Stormont because of the Northern Ireland Protocol. Budgets can't be signed off, decisions can't be made. 2 years from now, do you think we're still going to be in the same situation?
Unless we can improve the way that we provide services in the community, and unless we can empower, I think, our service users to feel confident to actually use the system differently, and we educate them in that, and unless I think we have an underpinning executive to help support even the legislative changes that are needed to drive some of that, I can see that this situation will continue.
The Northern Irish Department of Health say they're extremely concerned at the scale of current pressures, but say they've been clear they need more sustained investment. At Craigavon, exhausted patients carry on the wait to be seen or admitted. Exhausted staff get ready to replay the day all over again tomorrow.
Well, Channel 4 News has commissioned its own poll to find out what the public think is to blame for the crisis in the health service across the country. We'll be revealing the full results on our special tomorrow night. But Paul, you have some of the findings now.
Yeah, and remember, this poll isn't just about Northern Ireland where I am now. This is a poll about the entire health system across the whole of the UK. So more than 2,000 people were asked which, if any, of the following do you think is most to blame for the delays and shortages within the NHS at the moment. The results show there are 2 clear factors now that people blame. Top one, 30% say government policy. 24% say shortage of workers. And then the numbers really dropped down. Interestingly, only 8% blaming COVID, which was had such a major impact on the NHS. 6% saying the economy and cost of living. Only 4% saying strike action by the unions. Now remember, next year there will be a general election. The scale of the problems that the NHS is facing are so large, it's very unlikely it will all be sorted by next year, and the NHS will be a major factor in that election campaign for all parties. Those numbers you just seen in that poll are not great news for the government.
Paul McNamara. Well, joining me now is Dr. Ursula Mason, Chair for the Royal College of GPs in Northern Ireland. I'll ask you about the specific circumstances of Northern Ireland in a moment, but can I just get your reaction to that poll where the public are saying 30% of the public blame government policy for delays and shortages in the NHS, 24% say staff shortages. Does that chime with what you think?
Absolutely. I mean, I think what we can see from the public, what they've said is that, you know, the reality here in Northern Ireland and obviously across the rest of the UK is that we've had sustained cuts in investment into the health service, as well as poor workforce planning over the last decade. And that has led to a shortage of workforce and also a reduction in funding into core services across the health service. So it's not surprising that the public are reflecting what what we on the ground in the health service feel also.
Right. Well, what about the specific circumstances of the health and care service in Northern Ireland? I mean, because of course there you also have the added weight of not having a functioning government.
Absolutely. We are struggling and we are in a political void. And without that political leadership and decision making around transformation, there is a paralysis around being able to do something to affect positive change. So what we've heard already this evening around the pressures within hospital settings, within emergency departments and waiting lists, they will continue to cause problems and grow. And we will also in general practice see the impact of that on our service, because when other parts of the system don't work so well, we see that in terms of the pressure adding on us in terms of trying to deal with patients on a day-to-day basis in their communities. As that bedrock of the NHS and that sort of first point of contact for patients in a time of need, the excess work pressures that we have as a result of trying to meet the demand our patients have, not just because of urgent things or new problems, but patients languishing on waiting lists for many, many years, has an impact on both their health and their need to use health service. So if those patients had been seen in a timely manner, it would free up space for us to be able to see other patients who are trying to get through, trying to access our service. So the impact on general practice is huge, and we are struggling under a tsunami of need, very similar to the stories that you've already presented this evening.
And so do GPs in Northern Ireland find themselves telling patients to go to A&E?
So the reality of access to general practice in Northern Ireland and across the UK is that there aren't enough appointments, there aren't enough doctors to meet the demand that's there. But when you do get an appointment and when you do get through, actually what we're finding is that even with the sickest of patients that we see in our surgeries day and daily, if we tell them that they're sick enough to need to go to A&E or they need admission to hospital, they're actually fighting with us and arguing that they really don't want to do that because they know what the EDs look like, they know what they're facing, they know they're going to have corridor chairs and beds that are in makeshift wards, and the reality is that our patients don't want to do that. So we're actually finding that many times we're struggling with patients and trying to manage them in the communities when actually the best place for them is hospital, but they realise that the pressure in the system is so great that what they don't want to do is be sitting in a crowded emergency department or in an ambulance. And so more often than not, we're finding ourselves in that situation. With regards to telling patients to go to A&E, if we don't have access to be able to help them, that doesn't happen so often. We're trying our best to meet the sort of huge demand that's there at the moment. But with a service which is constricted in terms of workforce, there's only so much that we can do in any one day.
And just briefly, I mean, what you need is budget planning, don't you, for the future years, apart from anything else. What is your brief message to Northern Ireland's politicians who are not able to agree to start a government?
So my message would be that in the absence of a government, we are totally paralysed and unable to change and transform. Every day that there isn't a government in place, the NHS in Northern Ireland goes backwards. We need a government in place. We need a 3-year budget agreed, and we need sustained investment in places where it's going to make a huge difference. And the challenge here for us is being able to keep afloat or stay afloat in what is the most significant crisis that we have come up against, certainly in my career as a GP. And as I say, every day there is no government, we go backwards. And I'm not sure our health service in Northern Ireland can withstand that for much longer.
Dr. Mason, thank you very much for joining us.